A common question people often ask themselves when they're first quitting smoking is, are they ever going to stop thinking about smoking? People will stop thinking about smoking. You know, you will hear people say, oh no, they quit smoking, they still think about it. And again, when a person hears that, they think, oh gosh, they're thinking about it 365 days a year, you know, all waking hours. Then they're dreaming about smoking. Oh, people get thoughts after they quit. But as you get more and more time under your belt, those thoughts will become much less frequent. There'll be long latency periods in between where you're not thinking about it. And when you do get the thought, if you really focus your attention on why you quit smoking and why you don't want to be a smoker again, you will generally be able to squelch that thought pretty quickly. There's a difference between the urges that people get the first few days, and again, usually people thinking in these terms are worried about those urges. There's a difference between those urges that are physically based compared to the thoughts that people get months after they quit smoking. One of the ways that I try to get people to understand the difference between the physical urges and the psychological thoughts that people get down the road are, I compare it to something like a toothache. Have you ever had one of those toothaches where you have a pain? I mean, this is a big, big pain. You're calling a dentist office and you're not looking for an appointment next week, and no, you're not really looking for your next opening, you know, next month. You're in pain. You know, you're in pain. It's severe. It's significant. You feel like you maybe know you're not going to die, but you might want to. It is so severe. You'll do anything to stop this pain. Well, if you get the dentist on the phone or you get the office and you describe what's happening, they're working you in for an appointment. You see, this is no longer like a casual elective kind of procedure here. This person has a problem and it has to be treated. This is an emergency situation. Now, that is a physical pain. It's often caused by some problem at the root of the tooth. It's some nerve problem. There's some infection. There's a physical reason for this pain. Now, if you get to the dentist and the dentist starts running all his or her tests, they do x-rays, they do these different diagnostic things, trying to figure out what's the cause of the pain. When they're doing these tests, you're still in pain. In fact, when they get the results of those tests, they may come back with an x-ray and show you the physical reason for the pain. They're showing you the cause. Not only are they showing you the cause, but they may now describe. You know, the dentist may take it, the x-ray, and show it to you and describe the impulse of pain that's going through your body because, or going through the nerve in, you know, your face, wherever it is. And gives you a great explanation of why this is so painful. Now, how do you feel as soon as the dentist has now given you this wonderfully thorough explanation of why you're in pain? They're showing you the pictures. I mean, gosh, you understand now why you're in pain. How do you feel now that this person has spent all this time describing to you why you're in pain? You're furious at this point in time. You see, you didn't go to the dentist because you were looking for an explanation of why you were in pain. You didn't go to the dentist because you wanted to have a better understanding of why you were in pain. You went to the dentist because you wanted them to take the pain away. You wanted them to treat the pain. You wanted that dentist to, you know, pull that tooth. You wanted that dentist to give you Novocaine. You wanted the dentist to put a bullet through your brain. You wanted the dentist to take the pain away. Not explain the pain, but to take the pain away. That is a physical pain. Understanding it's not going to change it. That's why some of the withdrawals that people get the first few days. And then people will explain to them why it's happening. That people making that explanation, again, we're the people. Making that explanation, we have to also give the people a total understanding that just because we're giving you this information, it's not going to make the pain go away. There's some things we can tell you what to do to minimize the reaction. You know, when we try to help people stabilize their blood sugar because some of the symptoms are from a blood sugar reaction. So there's some things we can do to try to treat physically what's going on, you know, by people taking, you know, some other food at a certain point in time, or, you know, just some other technique to try to minimize the pain that a person may go through. But generally, it has to run its course. That's what a physical pain is from withdrawal. It's the same as a physical pain someone has when they have a cold. It has to run its course. All right, but then there are the psychological pains or psychological desires or wants. And those, they're not as easy to predict, but there are things that people can do to minimize them from happening and to minimize the duration that they last when they do occur. They can, in a sense, squelch those thoughts. See, they're psychological instead of physical. A physical pain is like a toothache that we were describing. A psychological pain, it's different. I'll give you an example. There was a movie made many years ago called The Marathon Man. And in that movie, Dustin Hoffman was in it. Dustin Hoffman is being tortured to get information out of him, but the torture is being done by a dentist with a drill. Now, if you saw this movie in a movie theater, there's a pretty good chance you can remember your reaction and the audience reaction. Everyone in that theater who ever had a dentist drill on their tooth for filling a cavity was responding when the dentist is taking the drill and, pouring it on into this guy's tooth, and there's the screaming that's going on, and people in that audience who ever had a drill on their tooth with a bad reaction to it would find themselves bringing their hand up to their face to protect their face. Well, let's understand something. The people in that movie theater were not in physical threat of pain. The people in that movie theater were not in physical pain, and yet the reaction that they were having would have been exactly as if somebody was coming into their mouth with a drill, because they were reacting to a situation that they could recall and they could remember. The thought for a cigarette is the same thing. It will create the sensation in a thought format of what's going to happen. Hey, if you didn't see the movie, you're going to the dentist. You're getting your teeth cleaned. You don't have a cavity. You don't have a cavity. You're getting your teeth cleaned. You hear a drill in the next room and you hear someone scream and you watch your reaction in that waiting room. It's like, I'm going in there next, and you don't want to go. But as soon as you realize there's no drill on your tooth, there's not going to be a drill on your tooth, again, you're getting a teeth cleaning. Or again, I'm in a movie theater. I'm not in physical threat of pain here. You can squelch the thought. You can push it out of your mind by focusing on why you don't want to be a smoker, why you don't want the other cigarettes that go with it. Then you could walk away from those thoughts. Now, the question comes, the original question that I was dealing with is, will you ever stop thinking about it? The answer again is yes, you will. That's the good news. The bad news is when you do stop thinking about it, you're in trouble. That is when you are at a greater risk of losing a quid than when you are thinking about it on a pretty regular basis. See, the advantage of when you think about cigarettes on a pretty regular basis, when you're still getting thoughts daily, you're talking yourself out of smoking daily. You have to. You get a thought, you got to do something to get yourself through the thought. Now again, some people try to think about something else, but others will reinforce the resolve of why they quit smoking. So the more thoughts they were getting, the more they were reinforcing the resolve not to smoke and getting through it victoriously. Then what will happen over time is you will slowly stop thinking about it, regularly. Get to a point you don't think about it daily. It'll get to a point you may not think about it weekly. Get to the point you won't even think about it monthly. Well, here's the problem. When you stop thinking about it, you stop talking yourself out of having to smoke. You don't have to talk yourself out of not smoking when you're not getting thoughts anymore. But that's setting you up for when the thought does come. And again, the thought may be weeks down the road. It's going to be some trigger circumstances going to happen. You get the thought. You haven't talked yourself out of smoking for so long that when you get the thought, you're not prepared to deal with it. And that could really catch a person off guard. The urges that you get months after you quit may hit harder than the urges you had the day you quit. It's not that they're as strong. They're not. It's not that they last as long. They don't. The difference is the ones you had initially, you had your guard up ready for them. The urges that happen down the road are insidious. They come out of nowhere, and you're not prepared for them. The trick is to stay prepared for them. The trick is, again, it's waking up every day and saying, I'm not going to smoke today. If that's the only thought you had that day, fine. But at least have that thought. And then go to bed at the end of the day and congratulate yourself for doing it. You want to keep reminding yourself you're an ex-smoker. You have to keep reminding yourself that a puff and a quit's going to go out the window. You want to keep reminding yourself of why you quit smoking. You want that on your side so when your urges do come, you're ready for them. So, will you get thoughts down the line? Yes, you will. Don't let them discourage you. Use them as moments in time to focus your attention on why you're glad not to be a smoker anymore. Use these things in your favor. The more thoughts you get, and the more you successfully talk yourself through those thoughts, the more determined you will continue to stay in your commitment to never take another puff.